Clouds Cry Too, with Catherine. Welcome back, everyone. This is the first episode of Clouds Cry 2 of 2018, so to begin, I'd like to wish you all a fantastic year. Well, since this is the first official episode in this podcast, I'm going to address a mental illness individually. I've thought very hard about this and came to the conclusion that the best option is to start with one I'm very familiar with. So today's episode is about anxiety. As you may or may not know, I've been diagnosed with generalized anxiety disorder. I've had it for almost 5 years and I've taken Xanax and Zoloft. However, I'm just taking Zoloft now. My medication is to control my anxiety, but mostly it is used to control my panic attacks. I've been doing some research about this theme so I can provide you the best information there is to know about this mental illness. Formally speaking, generalized anxiety disorder is a persistent, excessive, and irrational worry about situations or events. This affects a person's everyday life, and it is not something they can control. People often start imagining situations which upset their minds, even though they know they're very unlikely to happen. Common people often mistake anxiety and stress. For example, when I tell people that I have anxiety, many of them tell me, "Oh, but it's normal to feel nervous every once in a while when you're going to do a test for school or when you need to speak to an audience. That happens to everyone." Yes, you're absolutely right. Nervousness is a feeling everyone has felt. Anxiety, on the other hand, is not that simple, and it is not something that happens to everyone every once in a while. When you're nervous, there is always some factor that is causing it. Maybe you're stuck in traffic and you need to get to work in time. Maybe you're nervous because of an exam or a job interview. Maybe you have a deadline for a project. It's normal to feel nervous upon these situations. Anxiety, on the other hand, does not have a cause. It results from a fear, and most of the times an irrational one, and it stops you from doing your everyday life. The source of this uneasiness sometimes is not known, which can make you feel even more anxious. Another thing you should know is that people with anxiety disorders tend to overthink everything they do. You can talk to them about how the weather is like, and a week later, they might still be thinking about that conversation. They start questioning themselves, things like, "Why didn't he smile when he was talking to me? Is he mad at me? Did I smile too much? Does he think I'm weird? Maybe he thinks I'm a freak and never wants to talk to me again." To regular people, this might sound absurd, but I'm pretty sure people with anxiety will know exactly what I'm talking about. I do this a lot, and most of the times I can hear my subconscious telling me I'm being silly. That doesn't stop me from overthinking. After all of this, how can we identify a person with anxiety? A person with anxiety usually builds up fear and panic inside of them without any known reason, and they are not able to stay calm. They tend to have sleep problems, and when it comes to physical symptoms, they may feel their extremities numb, cold, or sweaty. They start having breathing problems, tachycardia, nausea, dizziness, difficulty concentrating, headaches, and so on. If you've been feeling these symptoms and you think you might have some kind of anxiety disorder, I advise you to seek the help of a psychologist so they can diagnose you properly. Anxiety disorders are not something normal that affects everyone, just like many people think. They are serious illnesses, and like I've said before, they can affect your everyday life and stop you from doing things you must do. Anxiety can result from genetics or from the use of certain substances. It has been proved that people with a genetic predisposition for generalized anxiety disorder are more likely to develop it. Anxiety can result from genetics or from the use of certain substances. It has been proved that people with a genetic predisposition for generalized anxiety disorder are more likely to develop it. On the other hand, the long-term use of benzodiazepines or alcohol can lead to anxiety disorders. The reduction of benzodiazepines and abstinence of alcohol can result in a disappearance of anxiety symptoms. Tobacco and caffeine have also been linked to anxiety disorders. For example, as a person with GAD, I cannot drink coffee. Unfortunately, there's not much you can do to prevent anxiety. However, many people have stated that meditation, relaxation exercises, and deep breathing practice have helped them. You should avoid nicotine and caffeine if you tend to be an anxious person. In spite of not being able to prevent it, you can treat anxiety disorders. Once again, you should seek out the help of a psychologist or psychiatrist so they can give you the best treatment. There is no one best way. That's something you have to keep in mind. People are different, so what may work for some may not work for others. To reduce anxiety, you can either do therapy or take medication. I've done both and I can assure you it really helps. I've done some research to find the types of therapy which are used to treat anxiety, so if you ever have to go to an appointment and they tell you need therapy, you can learn here more about what is going to happen. Don't be scared. Remember that you are there so you can improve your life, and they're only going to teach you how to deal with situations that cause you anxiety. The most common one is the cognitive behavioral therapy, and it consists in a therapist talking to their patient about how their thoughts and their emotions influence their behavior. In many cases, they expose the patient to anxiety-provoking situations so they can help them overcome their problem and feel more comfortable when something like that happens. There's another one very similar to this, which is called acceptance and commitment therapy. It encourages people to open up to uncomfortable feelings, and the therapist teaches them how not to overreact. What separates this type of therapy from the first one is the fact that in CBT you learn how to control your feelings and your thoughts, and in ACT you acknowledge and accept them, and they teach you how to cope with all of that. Intolerance of uncertainty therapy is used specifically for GAD patients, and it helps you deal with the uncertainty of life. People with anxiety tend to feel like they need to be in control or everything will go wrong, and this type of therapy makes you realize you cannot be in control of everything, and it makes you tolerate that aspect. The last one is motivational interviewing, which invites you to create a goal, and the therapist will help you reach it by influencing you to change your attitudes and your way of seeing life. This one is usually combined with CBT. If you do decide to go to a psychiatrist, they might prescribe you medication. To treat anxiety, they can give you SSRIs, which stands for selective serotonin reuptake inhibitors, benzodiazepines, or pregabalin and gabapentin. SSRIs are the most common ones, and they're used as antidepressants to treat major depression, anxiety, OCD, eating disorders, and so on. Lexapro, Zoloft, Prozac, these are just some of the most common ones in this group of drugs. Now, moving on to the most important part of this episode, how to cope with anxiety. I'm going to start with this first tip because to me this is the most essential one. You have to accept the fact that you are not able to control everything. I have this need to control every little aspect of my life, and when something gets out of hand, I get all stressed up and it makes me so nervous. But with time and the help of psychotherapy, I realized that unfortunately I cannot control everything that happens around me. And that's something I have to live with because there's nothing I can do to change it. I've also realized that sometimes it's good not to be in control because you have surprises in life that can add up to your happiness. Once you realize this, you'll live a more pleasant life. Now, to help prevent anxiety, you may have to change some details in your lifestyle. If you drink coffee or if you usually consume energetic drinks, stop with that habit. Your eating and drinking habits have a lot of influence in your nervous system. Start doing physical exercise. It has been proved that physical exercise releases hormones like serotonin that can help you with anxiety. Try meditation, yoga, deep breathing exercises. Meditation has helped me a lot of times when I'm about to face stressful situations. Take some time for yourself and do stuff that you love. This may sound obvious, but many people forget to take time for themselves, and their everyday life consists in work and stress, and in many cases, they don't have any time to do what they enjoy. Write, paint, sing, dance, read, draw, do what you like. Make sure you're getting enough sun exposure. Vitamin D is crucial for anxiety, so make sure you stand in the sun for at least 15 minutes every day. Sleeping is important. Make sure you're getting 7 to 10 hours of sleep every night. Distract yourself and listen to music, podcasts like this one, or audiobooks. It's something that allows you to escape from the real world, which can cause you to feel stressed, and it's something simple that you can do wherever you are. These are just some of the simple things you can do to reduce your anxiety. Now, psychologically speaking, there are also some things you can do. First of all, don't try to aim for perfection and do not put pressure on yourself. Be proud of who you are and of your achievements. Talk to someone about what you're feeling. Don't be afraid to expose your thoughts and emotions. Make an effort to keep away the negative thoughts and replace them with a positive attitude. Keep a journal of all the things that trigger your anxiety and stay away from people who cause you discomfort. Whenever you find yourself in a stressful situation, count to 20 slowly. Close your eyes and take deep breaths. Imagine yourself in a safe place that makes you happy. You can picture yourself on the beach, listening to the waves, or in a house in the woods where you're surrounded by nature, or simply lying down on your bed in your own room. To sum up, you simply must carry a healthy lifestyle and find out the best relaxation methods for you. I'd like to add one more thing before finishing this episode. If you know someone who has anxiety, respect them and don't treat anxiety as if it was just stress. As a person with anxiety, the most horrific, disrespectful, and offensive thing people have said to me is, "A little bit of stress is only good for you." No, stress is not good for me. I have anxiety, and this disorder has destroyed my life. I've lost so many opportunities of being happy in the past because I was afraid, and because this disorder was eating me up. So don't tell me that stress or anxiety or nervousness is good for me, even if it's just a little bit. It makes me very angry when people say that, so just don't. I hope this was helpful. I hope you liked it. Make sure you leave a message on my inbox on Tumblr, giving me feedback, and comment your opinions. I love you all. Thank you for listening. Bye bye.